Hello, this is Marcella, and I have now got, thought I had it up, 9/6/2025 Tuesday video. All right, and I have my camera in a weird place, so I hate to say this, I'm gonna have to be looking past you and looking kind of funny. So, all right, first thing, just to remind you, because one of your peers reminded me that you guys had that old crap pass. If you remember way back when, during orientation in February, I told you about an old crap pass that was in the orientation, in fact, and that's so that one assignment, especially I would use it on a high point assignment, every course, and here it is Sunday night, maybe 11 o'clock Sunday night, and there's no way you're going to be able to get this done, and it's like worth 50 points. And, if it goes 1 minute past midnight, you lose 25%. So the old crap pass is a pass that gives you an extra 24 hours in order to get it done. And that means it has to be done by Monday night at 23:59. This also means you can't wait until after it's due. So you can't wait until 12:05, Monday morning, 5 minutes after midnight, to request the OCRAP pass. So don't forget it's there. You can use it one time per course. And it was kind of cool. Everybody's kind of forgot about it. But you can only use it one time a course. So every course you can use it once. And you have to claim your OCRAP pass before midnight when it's due. All right, so there you go on that. Let me see. So your Practice B test is going to be available a little bit early. And it'll be available 9/11. In fact, it's been available. Closes at 9/21. And it does say that on the module. So if you happen to have noticed you had that early and available to you, and that's the ATI Practice Test B for the RN Adult Medical Surgical 2023 test. And it does close at midnight, the 21st. And of course, in order to redo it again, you have to make sure you have done that the focus review, but you do need to do it anyway. So in order to do it, you need to do your focus review. And you might ask, why do I need to do a focus review? And that's because you're supposed to be learning. And the focus review is what's going to help you learn what you did wrong, and so that you don't do it wrong again. All right. So just a reminder, the final is a med-surg test. So that'll be kind of cool. And we'll be coming back here next Monday to do that, to do your final. And then again, you can retake it the next week. All right. So everybody's pretty much who needs to sign the employee student rotation agreement form. So that's great. A reminder, I'm to remind you guys to don't forget your badges. Also, make sure whenever you're administering medication to do your identifiers, patient name, date of birth, the ID band for their MR medical records number, and of course you can also scan with your scanner, which is great. The 5 rights for patients are right patient, right medication, right dose, right route, and right time. And I'm sure y'all already have that memorized. I was just reminding you. All right, and Cindy reminded me yesterday, maybe it was the day before now, because this is an older thing, that if you have not gotten your new flu shot, that do need to get it done. The new flu shot comes out in the fall, usually around August time. And around August was this year when they started shipping out the new vaccine to all the clinics and doctors' offices and things like that. iTech, HCH, and HCN all require you to take the new flu shot every year. So if you decide not to take the flu shot, then you can do a flu declination paper. And if you do so, if you need one, just let me know. I do have the HCN declination forms up, but not the other ones. It's taking me too long to find the HCA. I didn't have time to do the NCH or the I Tech. All right, so the new requirements at NCH, and I talked about it yesterday, and I'm not sure if I was able to talk to everybody about it, but they have a new list of what a student nurse can or cannot do. So, I mean, it's their hospital, they pay the insurance, so, that's just what it is. Please be sure to read it, and I have got an assignment module under week 6 for you to read it and submit, the text. I can't remember exactly the wording, but it was like, I've read it, I agree, I understand, whatever, and then submit it for 10 points. So that's great. And also, when you do your new flu shot, just take the form they give you, whatever form they is, take a picture of it and submit it in its respective assignment module under week 6. We need to get all that done here like pronto, real quick. So that's why it's under a week, because it needs to be in there like yesterday kind of thing. So, I understand. And I did put in there to remind you all about the policy and procedures wherever you're at work. The liability insurance will cover you if you are following the policy and the procedures of that location, of the place you work, or at NCH or HCA. It'll cover you if you are following the policies and procedures. Now, if you go on your own way and you do your own thing, then everybody moves away from you and you are out there by yourself to receive the full blast. So if someone tells you, well, this is called a workaround, we're going to skip doing this, we're just going to go straight and do that, don't do it, because at that point, the liability insurance falls away from you. And if you've even got your own personal insurance, because some people do that, they have their own insurance to cover just in case the hospital's insurance decides that, I ain't going to cover you on that or whatever. They still have their own. But even with your own, there's going to be a big question. Well, why didn't you follow the policy and procedures? And just because you have your own insurance does not mean that you're going to win. It just means you are protected in case somebody else really doesn't have insurance on you. All right. So, and getting back to that form, one of them that we were doing was the IV pushes. Wrote a little note in the back of your CTR about, how fast it's supposed to be given, all this kind of stuff. But they decided that they don't want to cover students doing that. They don't want students to do it. So don't do it anymore. If you haven't done it, well, you'll do it as an RN when you get out. Just make sure to follow the directions on how fast to give it. Some of them are, like 1 cc a minute. So you're going to sit there with your watch or whatever, watch it doing a slow push. Got to do it the way you're supposed to do it. Always look up pushes. Make sure, if you're unsure at all, look it up. I mean, that's what that phone is on your hip. That's what it's for, is for looking stuff up. What do we all know, and we've talked about 100 times, is potassium. You'd never, ever give potassium as an IV push, because that will unalive them. In fact, that's what they put animals down in shelters with. So you want to be very careful on IV pushes. And from now till you graduate, they don't want you to do them anymore anyway. So don't do them. They won't cover you. All right, and there's a whole list of stuff there, so please read it and understand what you can or cannot do. Because remember, liability is kind of a big thing. All right, let me see, is there anything else? I think that's it. There's the question that I have for you is somewhere in there. And I give you the question right after I tell you the answer. So just read the agenda and you'll have it. Okay. All right, that's it. If you all have any questions, please call me. And please do that new flu shot as soon as possible. Just take a picture of whatever form they give you, submit it, and then we'll have it for your records, because we need one for our records here in iTech too, because you'll still be with us until March the 3rd. All right. Okay, I'll talk to you all later. Bye-bye.